Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Nasarawa and Lagos states received the Oxford AstraZeneca vaccine one day after Ogun State. National Association of Resident Doctors threatened to go on strike over alleged failure of government to meet demands. And rise in admissions push hospitals in France to the limit. Over 55 people have lost their lives in the last 1 week due to coronavirus complications in Nigeria. From the fatality figure recorded on Monday, higher than the 5 deaths recorded on Sunday. So far, this has raised the death toll in the past 6 days to 1,982 after 13 deaths were reported last night. There has been a decline in the number of daily infections. However, the death toll appears to be on the rise. According to the Nigeria Center for Disease Control, the country recorded 371 new COVID-19 cases on Monday, bringing the total number of known cases in the country to 158,906. The 371 new cases are reported from 16 states and the FCT. Lagos had the highest toll Monday's tally with 102 new cases, followed by Enugu with 56 cases and the FCT with 23 infections. In the update from Kaduna State, 14 samples returned positive out of 727 analyzed, while 35 patients are due for discharge. Local governments with new cases in Kaduna are Kaduna North, where 6 were registered, Lere 3 cases, Chikun 2, and Zaria 3. According to the center, a total of 138,502 patients have recovered in Nigeria after treatment. And discharges from today also includes 104 community recoveries in Lagos State, managed in line with the guidelines. Now, since the pandemic broke out February last year, the country has carried out over 1.6 million tests, while over 18,000 infections are still active in the country. The Lagos State government says it has received its share of the Oxford AstraZeneca COVID-19 vaccines from the federal government. This was disclosed on Tuesday by the Lagos State Governor, Mr. Babajide Sanwo-Olu, while speaking at the 2021 International Women's Day celebration organized by the Ministry of Women Affairs and Poverty Alleviation held at the Police College, Ikeja. According to the governor, the vaccines were received at 4 a.m. today, noting that the vaccines have been kept in a safe place. He assures Lagosians that the state government will soon commence the vaccinations in line with the scheduled guidelines laid down by the National Primary Healthcare Development Agency. He also implored Lagosians to continue to keep to the COVID-19 protocols like the wearing of face masks, hand washing, sanitizing, and also observing physical distancing. Meanwhile, in Nasarawa State, the government has taken delivery of over 61,000 doses of the COVID-19 vaccine. The Executive Secretary of the State Primary Healthcare Development Agency, Mohammed Addis, says the administration will start with health workers, followed by political office holders, and then people from 50 years and above. He added that plans have been concluded to administer the vaccine in all the local government areas of the state.
We are going to meet with the technical working group. We'll meet to discuss how we are going to roll it out. But it's going to come in the phases. In the first phase, we are going to roll out in specialist hospital Lafia, where we are going to start with the frontline health workers. It's expected that this afternoon we'll start vaccinating the frontline health workers. Then by tomorrow, God's willing, we'll start with the political office holder, and then those that are 50 years above. That is how we intend to do it in Nasarawa State. The state personnel, the health workers, have been trained on how to do this vaccination, and we are ready in all the local government in the state to ensure that this vaccine is given and is safe. And as a critical stakeholder in the health sector, I want to assure the citizens of Nasarawa State that we are going to demonstrate it by giving ourselves, the health workers in Nasarawa State, to show that this vaccine is safe. So let us encourage our loved ones to come and take this vaccine so that at least everybody will be back to work and economic activity will boost in Nasarawa State.
Meanwhile, over in Ogun State, the governor, Dakpa Abiodun, has taken his first dose of the COVID-19 vaccine at his office in Abeokuta, the state capital. It was administered by the State Commissioner for Health, Dr. Tomi Koka. Members of the State Executive Council and frontline health workers were also vaccinated.
Is there any reluctance on the part of us to take this vaccine? We also believe that this further underscores that we believe in this vaccine. And it's important, as we have been advised by specialists worldwide, that the vaccine is safe. The vaccine has been shown to reduce the severity of this disease, such that, worst case, it becomes a mild to very moderate, infection. However, we've been warned that the full benefit of the vaccine can only be enjoyed when you've taken the second dosage. So, even after this first course, you must continue to wear your face masks and continue to social distance. It's not a license to hit the streets and begin to party and begin to be reckless.
Staying in the southwest, legal luminary Afe Babalola is unhappy with the federal government's attitude to developing COVID-19 drugs and vaccines. The legal icon, in his address at the 8th convocation ceremonies in Afe Babalola University in Ado-Ekiti, also said that it's shameful for Nigeria to be receiving vaccines from India. Despite the brains that we have in the health sector, he believes the number of quality medical personnel produced by the country has not translated to good global rating.
For your information, in March last year, ABUA put together scientists and medical officers who worked day and night to manufacture COVID-19 drugs and vaccines. We entered into formal agreement with partners in Kenya and Japan. After working day and night for many months, applications were made to appropriate government agencies. And when we asked for accelerated action, we were rebuffed. And they queried us on why we were in a hurry. And added that after all, it takes 4 years in America to get such approval. Of course, that's a lie, because other countries like America, England, and India have worked on it and got answer within a year. That is on Nigeria.
Infectious diseases specialist Dr. Abdul Jalili Tafawa Balewa joins us on the frequently asked questions on COVID-19 vaccination and benefits of getting vaccinated. He joins us from our Abuja studio. Thank you for joining us on the program.
Thank you for having me.
So countries way ahead in its vaccination, like the US, they vaccinated over 30 million people. The CDC is giving new guidance, for example, that fully vaccinated persons can visit others who are also vaccinated indoors without wearing a mask, except when traveling. What's your take on this?
Well, that may be true for so many other countries, like you mentioned, that have done a lot. We, in Nigeria, we don't know how many people are actually infected with COVID, whether they are asymptomatic or not. I will say that after maybe 2 weeks of the final shot of this vaccine, if you're still negative, then you may be able to mix fairly well, but that's a long shot.
Pose a low risk to COVID-19 infection?
We don't know yet. You have to remember, this is an mRNA vaccine. We have not had anything like this in human populations before. I mean, not at this, on this large scale. We're not so sure.
So there are a couple of questions that people ask, such as if COVID-19 has a high number of over 80% survival rates, why then should they get vaccinated? What would you say to such people who have that thought?
Actually, to protect others. When you get vaccinated, it's really to protect others. The more people that get vaccinated, the more others get protected. The vaccine is fairly safe, but you need a large number of us to be vaccinated to have the herd immunity that we're talking about, or that so many people have talked about so often.
So perhaps the next question is, I mean, if I experience severe or long-term reaction, and this is by taking the vaccine, or even die, can one sue? Who can the person sue?
You cannot sue. Before this started, you have to remember, this is the shortest time that a vaccine had been produced in human history. And the manufacturers have asked for absolution. They're totally absolved from any of the problems that can arise from the vaccination. You cannot sue anyone, and there's nobody to sue, actually. Let's hope that fewer people will have severe reactions and even fewer will die.
Another question is, how long will the vaccine last in the body, and will one be resistant to the virus, COVID-19?
We don't know how long it will last because it's a very new procedure. You may not be resistant to COVID-19 because there are so many variants and all over. The one in South Africa, for instance, is almost resistant to the vaccine. There are several variants that are going all around the world. There's a major variant in Nigeria, the British variant, that may or may not be more virulent. You may not be immune to other strains or variants.
But of course, the non-pharmaceutical measures are still important. But then tell us, the tradition by healthcare workers for vaccination, is there a particular arm or site? I mean, there usually is for shots like yellow fever and the likes, when you look at the table that is used. So for COVID-19 vaccination, is there a particular arm, the left arm, the right arm?
No, actually, the arm is chosen by the fact that the opposite of your arm that you use often. Most people are right-handed, so you'll see most people vaccinated on the left hand. If you're left-handed, you should take your vaccinations on the right, because you're going to get some soreness for a day or two, and you should still be able to perform the your regular duties and chores or work.
Okay. All right. We'd like to thank you for clearing some of the myths a lot of people have with the vaccination. Thank you so much, infectious diseases specialist, Dr. Abdul-Jalil Tafawa-Balewa. Thank you for joining us on the program.
Thank you for having me.
Now, the National Association of Resident Doctors, NARD, has threatened to go on strike over the failure of the federal government to address their demands and implement the agreements reached with the association since last year. In a communique issued today and signed by the NARD president after a virtual national executive meeting, members resolved to proceed on a recess if their demands are not acceded to by government. Among their demands are the immediate payment of the salaries of members, the payment of the minimum wage and other salary arrears to its members nationwide without further delay, the immediate implementation of 50% of consolidated basic salary as hazard allowance for all healthcare workers, among others. Still to come on the program, nearly a year after the WHO first describes COVID-19 as a pandemic, we look at the lessons learned in public health. Please stay with us. Joining us right now is Dr. Blossom Madafokwa, public health physician and public relations officer for the Association of Public Health Physicians Lagos State Chapter. Thank you for joining us on the program.
Thank you so much for having me.
All right. Now, the WHO at the start of the week has been reflecting on why some countries did not jolt into action before the pandemic categorization. In Nigeria, how would you review our efforts since that announcement and its impact on Nigeria's public health?
So when you look at Nigeria over the past year, there are things that Nigeria got right, and there are obviously things that we didn't get right. One of the things that we got right was in our surveillance, in our contact tracing. In fact, I can actually tell you that just before COVID-19 was declared a pandemic, we had a Lassa fever outbreak. And myself and some of my colleagues had already been deployed to work on surveillance and contact tracing for that outbreak. So as soon as we had our first case of COVID-19, confirmed case of COVID-19 on February 27th of 2020, that whole infrastructure was now deployed for surveillance, contact tracing for COVID-19. So that infrastructure that we had in place already was actually what helped us sort of jump ahead of the curve. One of the things that, it's still debated up till today. One of the things that we missed, people say maybe we could have closed our borders a little bit earlier. We sort of dragged our feet a little bit before we closed our borders. So these are some of the things that Nigeria got right, and there's some areas that we need a lot of work. And I know that some of the knowledge and the experience that we've had are things that we built on from the Ebola outbreak, and we equally built on during this outbreak as well.
Indeed, some health experts have said that we perhaps relaxed in some other infectious diseases, like Lassa fever, yellow fever, and the likes. But looking at where we have seen meaningful progress in building stronger healthcare systems, where would you say we can find that? What particular area? I know the NCDC says it's expanded the surveillance and there's a lot more testing ongoing, but we also know that some of these testing sites for COVID-19 aren't meeting their daily capacity to test, for example.
Yes, you're exactly correct. There are so many things that we need to actually improve on. One of the areas, like you mentioned, is testing. I remember yesterday going for an occupational health surveillance visit, and some of the workers were asking, why are we making so much of a fuss over COVID-19? We have just 158,000 cases. And, I tried to explain to them we're not testing enough. And if you don't test enough, you're not going to identify cases. If you don't identify cases, then you're not going to be able to properly contact, trace, isolate individuals, quarantine the individuals that you need to quarantine. So we were really lagging behind in the areas of say testing. Also in the areas of our general expenditure in healthcare. Right now, we're spending only 4% of GDP on health, and this is far below required standards by any WHO standards, any country that is in the developed part of the world. So these are the areas that we need to invest more in human resources. We know we're not graduating enough medical doctors. More than half of the medical doctors that we do graduate go and work abroad. So these are the areas that we need to ramp up the capacity to be able to meet the needs, health needs of Nigerians.
So we're looking at the public health measures. The vaccines are being rolled out. We have Lagos State, there's Nasarawa, Ogun State. What's your take on the current strategy, and are the managers on track to tackle the spread and prevent a third wave?
So the current strategy is, first of all, to vaccinate frontline health workers. And then I believe the second phase is to vaccinate people within the government, and then those 50 years and over. One thing we have to realize, we're 200 million Nigerians. Currently, we have less than 4 million doses of the vaccine, and we know that it's a 2-dose vaccine. So 4 million doses will cover just 2 million Nigerians. And one thing that I tell people is, to be honest with you, your best defense at this point as a Nigerian is this face mask. This is your best defense. Because at the rate at which we're vaccinating, and we know that to reach herd immunity, to have enough people immune to this virus to stall transmission, we need to vaccinate a lot more and a lot faster. And right now, we're behind schedule to start with, and we don't even have enough doses to go around. So I implore Nigerians, we need to stick to non-pharmaceutical interventions. This, to be honest with you, at this point, this will be our easiest way out of this pandemic.
We appreciate your time on the program. Dr. Blossom Madafokwa, public health physician and Public Relations Officer, Association of Public Health Physicians, Lagos State Chapter. Thank you for joining us on the program. Stay safe.
Thank you.
Now, hospitals in and around Paris have been told to reduce non-COVID treatments by 40% as demand for intensive care beds, ICU, near saturation point. Yesterday, take-up of ICU beds for COVID-19 patients was just 83, short of the 1,050 capacity set aside for the region. France has tried to speed up its slow vaccination campaign, but remains affected by high infection rates. It has tried to avoid major lockdowns, and its health director said today that one in Paris would be a last resort.
Even though the number of people with COVID-19 in intensive care is at its highest since November, authorities in France say it's not planning to put the Paris region into lockdown. The head of the intensive care unit at Melun Hospital Center warns that hospitals in the region are getting close to capacity. The number of patients in ICU beds reached a 14-week high on Monday at 3,849. The figure was almost 1,000 for the Paris region. Elsewhere in Europe, Italy registered 318 new deaths in the past 24 hours, bringing its total death toll to 100,103 people, making it the second country in Europe after Britain to pass the 100,000 fatality threshold. Meanwhile, Italy's new Prime Minister Mario Draghi has pledged to speed up its vaccination plan in order for residents to return to a normal life soon. Today marks 1 year since then Prime Minister Giuseppe Conte announced the country was entering a nationwide lockdown after Italy became the first country in the Western world to be hit by an outbreak of the virus. In the meantime, Russia says plans to produce Russia's Sputnik V vaccine against COVID-19 in Italy would help quickly satisfy demand for the shot abroad. The Kremlin's comments comes after the Moscow-based RDIF Sovereign Wealth Fund and Swiss-based pharmaceutical company Adenine signed a deal to produce Sputnik V in Italy.
Continue to take responsibility. Visit our website for more updates and a better understanding of the pandemic. It's channelstv.com. You can find several other stories there on our website. Thank you for watching the COVID-19 update. I'm Millicent Walker. Stay healthy.